ಎಲ್ಲರಿಗೂ ನನ್ನ ನಮಸ್ಕಾರಗಳು. I am Dr. Abhishek Samdesi and I am a pulmonologist, and today I'll be talking regarding the home care to be given in patients with COVID. This is as per the guidelines from the Ministry of Health and Family Welfare and WHO guidelines. With the number of cases rising drastically, the hospital admissions are required for moderate to severe cases, whereas for patients with asymptomatic or mild cases, home isolation is advocated. Now, once the patient is at home, what is the care to be given? What is the precautions to be followed by the caregiver as well as the patient at home? I'll be discussing regarding the same under the following headings. First is the patient criteria for home isolation. The second thing is the instructions to the patient, what he has to do and what he should not do. Then I'll be talking regarding the instructions to the caregivers or the family members. Then I shall talk regarding treatment of asymptomatic or mild cases. And after that, when to seek medical consultation or attention, and then when to discontinue home isolation. Under these topics, we shall discuss one by one. Let's begin with the patient criteria for home isolation. What type of patients are to be isolated at home? They are the asymptomatic positives. They do not have any symptoms and they have turned COVID positive. The other people are the symptomatic or the ones with saturation more than 94%. The other criteria is those who have symptoms. The following symptoms are fever, sore throat, anosmia, loss of taste, and cough. They should not have any breathlessness or any chest pain. These are the criteria for patients who can be isolated at home and care to be given at home. Next, moving on to the instruction given to the patient. So, what are the instructions that the patient has to follow? Number one is hand hygiene. The patient is supposed to frequently wash their hands with soap and water. The second thing that we recommend the patient is to stay at home, take adequate rest, have proper nutrition, as well as drink adequate fluids and take proper sleep. This I have discussed in my previous video regarding the steps required or how to boost your immunity against COVID. You can definitely go back and have a look regarding the same. So the same thing even the patients will be following here. The other thing the patient has to do is to stay in a separate room from other family members, and also ensure that there is adequate ventilation to the room, and also whenever the patient is interacting with the family members, the patient and the family caregivers or the family members should be wearing a mask, and a distance of minimum 1 meter has to be maintained. Keep the rooms well ventilated by opening the windows. Ensure that there is cross ventilation, and make sure that you don't use ACs because ACs can recirculate the same air inside the house. And it is preferable that the patient uses a separate bathroom, and preferably the family members should not use the bathroom that the patient is using. The next thing that the patient is supposed to do is follow strict cough hygiene. Now, once all these things are done, the other thing that we recommend the patient to do is to maintain a chart where the patient will self monitor. What is required for this is a thermometer to measure the temperature and a pulse oximeter to measure the pulse and saturation. In this pandemic, it is recommended that each and every family has a dedicated thermometer and a pulse oximeter at home every time. So if you maintain a chart by rating the first day of symptom as day 1 and document the date and day, then make the following columns for time. So here you'll be rating at what time the vitals were measured. It is recommended that you monitor the vitals once in every 4 hours. The other thing that you are going to document or monitor is temperature, pulse, saturation, and how the patient feels. Does he feel better, the same, or worse? And also if the patient has breathlessness, is it better, is it same, or is it getting worse? This will be charted every once in 4 hours by the patient himself. In case there is deterioration in the saturation of less than 94%, and if the patient is not feeling better, as well as if the patient is feeling breathless, immediately contact your doctor so that the doctor can advise for further necessary actions. Next, moving on to the instructions to the caregivers. Those who are taking care of the patient at home have to follow these measures very strictly. So ensure that the patient drinks adequate water, takes adequate rest, and the nutrition is met. As I mentioned prior, not only the patient, even the caregiver has to wear a mask. It is preferable if the patient wears N95 and the caregiver can wear a medical mask or a triple layered cloth mask. It is recommended that you have to frequently wash your hands with soap and water whenever you come in contact with the patient or their surroundings, and also before, during, and after preparation of food, and even before eating or after using the toilet. The family member or the caregiver are supposed to wash their hands with soap and water. Keep separate plates, spoons, glasses for the patient, and also ensure that the clothes of the patient is not mixed with your clothes while washing. After washing the utensils, make sure that you wash your hand thoroughly with soap and water. Unlike this diagram, whenever you're handling with the patient's clothes or utensils, do wear a mask. Also, you can disinfect the frequently touched items by the patient with sanitizers. Whenever the patient is clinically worsening or patient has breathlessness, immediately contact your doctor. The next thing that we shall discuss is regarding the treatment of asymptomatic or mild cases. First, always be in communication with the treating physician in case of any deteriorating symptoms. Next, continue the treatment of comorbid illness. If the patient is a known hypertensive, diabetic, or asthma, do continue the treatment that was advised by your physician. Do not discontinue your medicines without consulting your doctor. It is recommended that you take steam inhalation twice a day, betadine gargle twice a day, and you can take tablet paracetamol 650 milligram only if you have fever. Don't make it a habit to take it continuous 3 times in a day or 4 times in a day. Always take paracetamol only after documenting fever. I personally would recommend that even before you give paracetamol tablet, when the patient has high grade fever, first do tepid sponging. You can dip a cloth in water and squeeze it out dry, and then place the wet cloth or the towel over the patient body to decrease the temperature. And if that fails, do go ahead with paracetamol. The next thing that the Ministry of Health and Family Welfare recommends is to use tab ivermectin 12 mg once a day before food for 3 to 5 days. This will be started by your pulmonologist or your physician. And as per the new guidelines, they recommend to use inhaler budesonide with spacer 400 micrograms to puff twice a day with spacer. It is recommended only when the patient has persisting fever and recurrent troublesome cough that is lasting more than 5 days. Only after that you can consider inhaler budesonide with spacer. Even the guidelines from the Ministry of Health and Family Welfare, the GINA guidelines, the GOLD guidelines, does not recommend use of nebulizer in patients with COVID. Do not use nebulizer at home. I prefer the use of inhaler budesonide with spacer. The technique I have already taught in a previous video. I will just drop the link down below. You can go through the video on how to use inhaler with a spacer. The next thing is when to start the patient on oral corticosteroids. So oral corticosteroids are not at all indicated in mild diseases. The indication is when the symptoms last more than 7 days, and it is reserved for moderate to severe cases. The indication would be if the saturation drops less than 94 or 93%, they are potential candidates for whom the oral corticosteroids can be started, and this will be started by the doctor. Do not take your independent decisions on oral corticosteroids. Always ask your pulmonologist or your physician. Then regarding remdesivir, when to give and when not to give. Do not procure it or administer at home. Remdesivir is reserved for moderate to severe COVID cases. It is not recommended for mild COVID cases. Moving to the next topic, which is when to seek medical attention. These points are the ones when you have to show to the doctor immediately or get admitted. One is difficulty in breathing. When the oxygen saturation falls below 94%, whenever the patient experiences left-sided chest pain or persisting chest pain, and when there is mental confusion or inability to arouse, or when the symptoms persist beyond 7 days. These are the red flag signs which will require medical attention. The next thing is when to discontinue home isolation. This is after 10 days have passed after the onset of symptoms. Secondly, it can be after 10 days from the date of sampling in an asymptomatic case, and no fever should be there in the last 3 days. That is when home isolation can be discontinued. And as per the recommendation of Ministry of Health and Family Welfare, they tell that there is no need for testing after home isolation period is over. So these are all the necessary steps to be followed while giving home care for patients with COVID. In case of any queries, do let me know in the comment section below. And everyone, please take care of yourselves and stay home and stay safe. Thank you.